basically this topic is allotted for the clinical trials because the entire program is organized by ISG. Obviously, they would be interested in the clinical trials of various disorders, not only of celiac disease, but there are several topics that are being discussed in these forums, and clinical trials is a part of the presentations. So anyway, in the south, there are a lot of trials we have on inflammatory bowel disease, but in south we have less trials on celiac disease. But anyway, I'm not going to tell what trials we have got, but I'm trying to tell you the various trials that are going on in India and abroad. So any trial, usually they are registered, then they'll be available online. So there are a few registered trials now going on in India. I will take just one study, just elaborate a bit, and then move to the other slide. I will take the second one here, role of Reg1 alpha as a marker for adherence to gluten-free diet in celiac disease. Only concentrate on the second one. So this regenerating gene 1 alpha, that is a Reg1 alpha, test is determined by ELISA. And this Reg1 alpha decreases in gluten-free diet. So if the Reg1 alpha is more, then that means the patient is not adequately consuming the gluten-free diet. So this tells us that whether the patient is compliant or not. I think this is one of the trials in India. So we'll go to the next one. This is a worldwide clinical trials. I'll take the last one. That is the study of guselkumab in adult patients with celiac disease. This guselkumab is IL-23 inhibitor. IL-23 inhibitors are now quite well known in inflammatory bowel disease, but this is a guselkumab is somewhat used in psoriasis, and the dose is 100 milligrams subcutaneously. So this there is a study using guselkumab in celiac disease, and obviously this would be used in patients who are inadequately responding to the gluten-free diet. So IL-23 inhibitor, there's some trial that is going on. So another one we will take is the IL-15 blocker we'll take, because IL-15s could become popular. The third study, that is the PRV015, there's a number, in gluten-free diet in non-responsive celiac disease. So in non-responsive celiac disease, this monoclonal antibody is being tried. This is a IL-15 blocker that IL-15 plays a major role in central role in non-responding celiac disease. So there is a trial going on with IL-15 blockers. In this also I will take up just one. Again, there is one IL-15 blocker, and I will take the third one. Assessment of adherence to gluten-free diet by detection of gluten in fecal samples. So whether the patient is following the gluten-free diet or not, feces and sometimes the urine samples are also can be done for GIP, gluten immunogenic peptides are estimated in fecal samples. So this helps us in knowing whether the patient is compliant or not. I think this is one of the trials that is being done with the fecal samples and estimating the GIP. So the various future therapies also mentioned by Dr. Ashish. So I will not go into all the details, just the immunotherapy part, the last slide, last part, anti-IL-15, anti-TNF, anti-IFN, interferon. But IL-10 is to be used. So these are some of the monoclonal antibodies that are being tried in the celiac disease. So concluding, say that celiac disease is common in West and in North India, and it is uncommon in South India. There is a antibody prevalence study, I think this is from Vellore. The celiac autoantibodies are found in 1.2% of North India and 0.1% in South India. The celiac disease could have some incomplete response to gluten-free diet. So adherence to gluten-free diet may be difficult. Just eating a small biscuit or a small piece of bread or cake then could cause problems. So newer effective therapies are required because compliance can be difficult because the compliance is to be there for life. And prevalence of celiac disease seems to be increasing. This is the information world over, not necessarily from South India, but in South India, we could be missing some cases which are having atypical presentations. And immunotherapy and treatment of refractory celiac disease and development of vaccines. This needs to be required in areas where the disease is in higher prevalence. So wider education about celiac disease would benefit one and all, and it is one of the classical disorders in gastroenterology. Everybody is taught right from MBBS, and in gastroenterology training programs, this disease is given a lot of importance. And there are also clinics conducted in various institutions, central institutions, for one OPD or half a OPD is given for these patients. And my tenure at SGPGI has helped and seen a lot of celiac disease patients. And there are a lot of publications from PGI Chandigarh and SGPGI Lucknow, and also, of course, from AIMS and some in other parts of the country. And Sanjay Gandhi had a lot of publications from Dr. Yacha, Dr. Poddar, and Dr. Anshu Srivastava.
Thank you, Dr. Ravi Shankar and Ashish Kumar Jha, for your excellent presentation about celiac disease. Especially one definition itself says that it is chronic, it is immune mediated, it is gluten sensitive, small intestinal enteropathy with genetic predisposition. So that definition in the Schlesinger what he has given encompasses the entire spectrum of celiac disease. But here you have covered the classical presentations of celiac disease and the unclassical, that is atypical presentations of celiac disease, and it leaves no organ uninvolved. It has involved the brain, heart, lungs, musculoskeletal system, nervous system, cardiovascular system, genitourinary system, whatnot, and regarding fertility, amenorrhea, and hypothalamo-pituitary adrenal axis also causing short stature and many myriads of problems. But as you said, the only important aspect here is, because we may be missing as gastroenterologists, because the classical presentation of diarrhea, steatorrhea, malabsorption, and nutritional deficiencies, if it is forthcoming, anyone can diagnose, anyone can suspect it. But if there are atypical presentations and more so with extraintestinal manifestations, then it is very difficult. Then high index of suspicion is required. And the most important aspect here is the development of serological arms and ammunition, especially with the advent of this anti-TTG antibody. That is very, very important, because either two anti-gliadin antibodies were there, they were very non-specific, then anti-endomysial antibody and anti-TTG antibody. They have helped a lot, especially Govind Makaria et al. They have studied recently that in children, especially with positive serology, even you can avoid biopsy. But the only one important aspect here is children, because once you diagnose celiac disease, lifelong gluten-free diet means definitely the adherence will be a big problem, and a careful, dedicated dietitians are required. And everywhere on the food packets also, they are written gluten-free in North America, North India, everywhere. But a total dedication and involvement is very much important. As far as the refractory celiacs prove, sometimes the exact cause is not known for unresponsive celiac disease, because sometimes they adhere very much to this one. Probably the environmental factors, additional burden complicating the presentation and confusing the diagnosis might be involved in the further progression of these diseases. But as the clonality of T cells and T cell receptor gamma is very important, especially in the genesis of these refractory celiac fruit type 2, which can lead to ulcerative ileitis and this enteropathy associated T cell lymphoma and small intestinal carcinoma. The newer therapies both of you have mentioned are excellent, because if they come into the action, definitely it will be a great boon to the humanity, because gluten-free diet adherence definitely is very difficult. Sometimes even small indulgence or small excess, suddenly, accidentally, inadvertently gluten exposure can result in gliadin shock. That is, they will go into severe diarrhea, dehydration, shock, and renal failure also. That's called gliadin crisis or celiac crisis. So sometimes it might happen with children more so, or adults also, if they inadvertently take some gluten, having been on gluten-free diet for a long time. So the discussion went off very well. We have covered all the aspects. One or two questions are there. Just we will finish off these questions. And the questions are: Dr. Malati Balraj, Maharashtra, asked, will celiac disease affect fertility? Any special precautions? Ravi Shankar, can you please explain about it?
Yeah, it can have an effect on the fertility, and there can be amenorrhea, things like that. And these patients obviously should be properly diagnosed, evaluated, and gluten-free diets have to be given to these patients if they have the problems. So, maintaining a gluten-free diet in a celiac disease patient in a woman of childbearing age seems very important. And if there is effect on the fertility, which is not a must, but if there is an effect on the fertility, we need to maintain the gluten-free diet.
So what I feel is, in those areas where there is a high prevalence of celiac disease, infertility problem should be considered, and the celiac disease should be considered if you are confronted with infertility problem in a couple. That's what I feel. But male agiospermia and all these things are not described.
Male infertility also is described, sir, in cases which are.
So both male and female have to be addressed. Both problems have to be addressed.
Exactly.
So actually, this serology coupled with biopsy will have excellent results in the making up of the diagnosis. But sometimes even serology is enough to suspect and put the patient. But because the patient has to be on lifelong gluten-free diet, one has to be extra cautious and meticulously diligent in making a diagnosis and asking them to go for gluten-free diet lifelong. Because as other alternative therapies or other alternative dietary managements and other dietary things have not come into force so far. Then the other question is Shish Kumar from Uttar Pradesh, atypical presentation of MI. I don't know what is that MI, I am unable to understand.
Maybe some typing error, something has happened. But probably is asking about the atypical presentations of the celiac disease. So we have mentioned different types of presentations, which are classical presentations, and we have mentioned the atypical presentations and extraintestinal manifestations, and patient with celiac disease presenting with refractory diseases, and then development of malignancy, ulcerative jejunoulitis, so on. So many things, clinical features we have described in this forum. I think before that, the question had come up early in the discussion. I think the discussion has answered Shashi's question.
Okay, thank you. So those are only the questions we got. And I think we have covered entire spectrum of celiac disease in a beautiful way, in a lucid manner. And we have driven the message that celiac disease is an important disease burden in our country as well as across the globe, because many of the people around the globe are also facing this problem of celiac disease. So, because if a pathological fracture occurs, you have to suspect celiac disease. If a patient comes with cerebral involvement, think of celiac disease. So that is very weird also, because such a long, big spectrum of presentations they have mentioned, and associated autoimmune disorders, hypoparathyroidism, hypothyroidism, whatnot, everything. But only thing is a high index of suspicion in a highly prevalent area for celiac disease is very important. That's what I feel. But research-wise, a lot of research is going on, especially at the level of Govind Makaria and other pioneers.
Yes, I think in South also, maybe areas where we are missing out on the celiac disease we can pick up. The one seroprevalence study Dr. Ramakrishna has done from CMC Vellore, I think that type of studies we can always do. We can always compare the, example, in the South Indian city, South Indian population and North Indian population, sero testings can be done. And In fact, in IBS type of symptoms, we can do the seroprevalence, TTG estimations, and then
Yeah, that
this
is an
type of
excellent
things we
idea
can do.
because even in Kurnool, in our area, we have a lot of North Indians. Hyderabad, okay, well and done. Some 30 to 20 to 30% of population are North Indians because they came at the time of Nawab Nizam. So in Kurnool, if they are infiltrating everywhere, it's quite common. So as you suggested, that study can be done here also. What do you say,
Yes, of
Ashish?
course.
Sir, actually, in Eastern Zone, prevalence is considered to be very low, and so in our institute, we are conducting already a study in high-risk patients, especially IBS and other things. So we are collecting data already. We have screened almost 250 patients in last 2 years, 2.5 years actually, because of COVID and other issue. Study is not actually published, another thing. So if we search actively, we actually test comes positive. So it's not rare in other part of India. If we search actively, we find we diagnose patients in eastern
Yes.
I think
part
in
of.
functional diarrheas and IBS type of patients who are not very classical, then I think these things, TTG estimations would go a better benefit.
And we do
Yes.
frequently this TTG estimation and D2 biopsy, and we not like Delhi, UP, and Western UP and Rajasthan, but prevalence is not so rare like South India.
Thank you, Ashish. Thank
Yes,
you
sir.
so much.
Thank you, sir. Thank you.